Today we introduce key points about normal aging of the heart. These age-dependent changes alter the older adult's resiliency to stressors such as ischemia and increased workload. In Frida Kahlo's painting, we see an artistic interpretation of a bleeding or broken heart, which actually can be associated with a medical condition called broken heart syndrome. Do you know the medical term for this type of cardiomyopathy? As we consider aging processes, it is important to recognize that aging per se is not a disease state. Thus, we need to distinguish changes in heart function as a matter of age versus disease. For example, shortness of breath and mountain sickness may be more prevalent in older than younger adults due to age-related heart and lung changes, whereas shortness of breath experienced during routine activities such as walking would more likely indicate heart disease. As we age, we experience loss of homeostatic reserves, or the ability of an organ to bounce back from a perturbation. Diseases such as heart failure can further encroach upon homeostasis and delay older adult recovery from an acute illness. Homeostenosis is a term that describes the dwindling reserves of aging organs to counter stressors such as heat stroke, poor air quality, and febrile illnesses. In this slide, Toulouse-Lautrec provides a sketch of a high-wire act that can be used as a metaphor of the balance that aging organs need to achieve in face of external and internal challenges to homeostasis. Key points we need to consider about the aging heart include anatomic and physiologic changes. Anatomically, the left ventricle becomes thicker with age, and increased wall thickness contributes to less blood volume being ejected by the heart. Reduced heart volume accompanies a less compliant heart due to fibrotic changes. At the cellular level, age results in bioenergetic perturbations, as manifest by less efficient and fewer numbers of mitochondria. Clinically, we see increased cardiac arrhythmias with aging, such as atrial fibrillation and flutter. These types of arrhythmias can increase the risk of embolic strokes. Histology of the aging heart shows increased fibrosis, collagen deposition, and calcification. Additionally, we see more fatty infiltration and markedly less numbers of specialized heart cells responsible for electrical conduction. This diagram further illustrates how age impacts the heart cells and their connective tissue. One prevailing theory of aging posits that terminally differentiated or senescent fibroblasts create an inflammatory milieu that drives fibrosis and cellular damage over time. Geriatric research explores ways to delete these senescent cell types and partially rejuvenate aging organs. This diagram of the heart shows how the heart may progress to heart failure with reduced ejection fraction or heart failure with preserved ejection fraction. Clinically, the failing heart goes through cycles of worsening function, followed by some level of recovery. This seesaw effect is one of the reasons people with systolic heart failure, that is, heart failure with reduced ejection fraction, repeatedly get admitted to hospitals. You can use the Seattle Heart Failure Index to help you and your patients estimate remaining life expectancy. The astute clinician needs to be mindful of atypical presentations of common diseases in older adults. For example, the classic anginal or heart attack symptom of retrosternal chest pain in the older adult may entail other symptoms, such as epigastric fullness or indigestion. Sometimes confusion and new-onset weakness can present as atypical symptoms of coronary artery diseases, such as a myocardial infarction. Notice this case report. An 88-year-old female and recent widow reports that her legs became heavy and she gradually collapsed onto the ground as she was walking from her front entrance of her house to her daughter's car parked in the driveway. She did not lose consciousness and did not feel dizzy. She felt short of breath. The most likely explanation of the symptom is which of the following? A. Aortic stenosis. B. Mitral regurgitation. C. Coronary artery syndrome, or D. Takotsubo syndrome, broken heart. The answer is D. Takotsubo syndrome, broken heart.